Hi guys, so there are few tips I wanted to share about wearing aligners. First of all is that you have to be very gentle with your aligners when you're wearing them and taking them out, and with the remover tool pull it very gently, as I said in one of my previous videos. And the second thing is that you cannot eat anything with your aligners, and you have to use your chewy, this thing, I'll show you, this thing, to bite it all over so that it sits properly in the position and the movement can happen. And the second thing is that when you wear a new set of aligners, it will definitely there will be some pain for 1 or 2 days, and it's okay, it's normal, and it's very bearable pain. And if you have attachments on the anterior teeth, make sure that they match the color with your teeth, because composite over a period of time it will discolor and it will stain, and if that happens, it's okay, it's normal. So you can go and get it changed from your orthodontist. You have the full benefit of going and getting that done. The other very important tip is that you need to make sure that they give you a template for the teeth, so that you can very in the initial stages, so that you can place the composite. So you have to make sure that don't throw your template the template package that you have. Please don't throw it, keep it safe with you, so that if in case your composite attachment does break, you can still put it back in and get it done. So I actually, being a dentist, I have it with me only, but if you are a patient, make sure that your doctor keeps it. Most probably they will keep it, but still that is what I wanted to tell you. And yes, you have to make sure that you brush, you take a brush. I actually got a brush recently for my teeth only. So while I brush my teeth, when I take it out, I brush the inner surface, because there's some saliva aggregated on the inner surface of my aligners, on the inner surface. So I just very gently brush it in, and put it under water with so that it cleans off, and that's it. And yeah, because I got a proximal stripping, so every case is different. My case I had to do proximal stripping for 2.5 mm, and that's a lot. That's actually a lot. You can see both sides, so the space is slightly closing in one area. And the thing is, if you happen to get proximal stripping done in any of your ortho cases, the thing you have to make sure is that you make sure that the area is clean. There is no food lodgement, the food doesn't get stuck there. So you always have a dental floss, or if it's a very large space like mine, you can have an interdental brush. I'll show you too. So this is the floss that I use, and this is normal black floss, and this is the interproximal brush that I'm talking about. So if you have a lot of space, you can clean your tooth like this. This is the motion that you do, in and out. You don't twist it, you don't pull it, just put it in and out. That's it. And you clean the bristles afterwards and then put it back in. So that is that. And make sure that you brush your teeth before sleeping, before putting this in. Make sure, if you don't, I carry these around with me all the time in my purse, so I make sure that my teeth are neat and clean and tidy. And sometimes it is annoying, and I don't know, maybe to help with the pain, maybe to just make sure that my teeth are clean, I do use the chewing gum. I feel that sometimes there are some particles left here or there off after you eat a food, so it's better to always eat a chewing gum. So after eating, you can use a chewing gum. What it actually does is lowers the pH to the normal pH level, and it helps with the fact that it decreases the pH, so that otherwise, if you don't have a chewing gum afterwards, the pH it does come down to normal, but it takes a little while for it to happen. So with chewing gum, the pH gets to normal, and I feel that some minor food particles and all, it takes it away, and you feel refreshed, and it helps with the pain a little bit. I feel that. So these are the few tips. Thank you for watching. Bye.